Hello, Dr. Pedada. My name is Dr. Punaka, and this is station 3 of the MRCP PACES exam, and we've got an abdominal examination. This is Luke, a 21-year-old university student who has been referred by his GP to the gastroenterology clinic with abdominal pain and being unwell. Would you like to examine his abdominal system, please?
Hello, is it Luke?
Yes.
Nice to meet you, I'm Dr. Pedada. Is it okay if I examine your abdomen and a few other parts in your body?
Yeah, that's right.
Right, okay. Can I ask you to just take your gown down if that's alright for me? Thank you. Okay. So, just having a good, nice look at you now, okay? Right, okay. Just gonna have a look if you've got any scars or anything anywhere, okay? Right, can I have a look at your hands if that's alright? That's great. Have you got any pain anywhere?
A little bit pain of it there.
Okay, thank you for that. Okay, that's great. So looking for any evidence of clubbing? Nothing? No leukonychia, no other significant nail changes. There's no wasting of the muscles. Okay, can I just ask you to... So, there's no palmar erythema, no Dupuytren's contracture. Okay, just stretch your hands out, cock up your wrists like that for me, that's it, brilliant. So no evidence of any hepatic flap, that's brilliant, thank you, you can rest this hand down. Thank you very much. So, ideally I'd like to check his pulse for 30 seconds. Right, can I just have a feel of your neck? Feeling for any lymph nodes? So I'll try to be gentle. So no evidence of any cervical lymphadenopathy. I'd like to also check his axillary and inguinal lymph nodes.
Okay, we can do that later.
Right, okay, I'm going to pull down on your eyelids, okay? Just looking for any evidence of anemia. Looking up, look down for me. There's a faint tint of yellow pigment in the sclera. Right, okay. Would you like to just lie down flat for me, please? That's great, okay. Again, having a good look for any scars, sinuses, any evidence of chronic liver disease, petechiae, bruising, scratch marks, spider nevi, any evidence of any AV fistulas, nothing. Okay, I'm just going to gently feel on your tummy now, okay? Right. So I'm going to try to get down to the level of the patient. So I'm just going to gently feel, sorry about that. Going in a bit deeper now. A bit painful there. Okay. Okay. I'm just gonna feel for his liver now. So would you be able to just take some nice deep breaths in and out, Luke, for me, please? Breathe in. Sorry about that, sorry. Okay, I'm just going to tap on your tummy now. Okay. Okay. Gonna feel for your kidneys now. Just lift your back up a bit. That's it, rest it. Okay. That's great. Okay. just going to have a listen.
1 minute remaining.
1 minute more.
No evidence of any hums or bruit. Just going to press on your ankles, okay? Looking for any pedal edema. No evidence of any pedal edema. Right, okay. That's great. Thank you very much. You can now dress up.
Oh, thank you.
Okay, have you finished?
Yes. So to complete my examination, I'd like to perform a shifting dullness test, check his urine dip, and also I'd like to examine for a full lymphadenopathy screen, including the axillary and inguinal lymph nodes. And I'd also like to check his observations.
Okay, good. Would you like to present your case now, please?
So I've examined a 21-year-old university student who's come in with abdominal pain. The only positive findings on my examination were jaundice and a 2-finger breadth hepatomegaly. There was no obvious organomegaly or no other signs of chronic liver disease. There was no other scars or sinuses.
Okay, that's good. So tell me, you mentioned about jaundice. Are you sure the patient was jaundiced?
So he had a very faint hint of jaundice. He wasn't overtly jaundiced.
Okay. And you mentioned about a 2-finger breadth hepatomegaly. Was the patient tender in his abdomen?
Yes. So he had tender hepatomegaly on palpation.
Okay. Would you like to think of a few causes of a tender hepatomegaly in a young patient like Luke?
Okay. So top of my differentials would be hepatitis, which could either be infective or alcoholic hepatitis.
Okay.
The other things I would like to rule out would be any kind of malignancies and any infiltrative disorders,
Okay.
Budd-Chiari syndrome,
Okay.
congestive cardiac failure,
Okay.
although unlikely in his case for his
Okay.
age.
Okay.
And I'd like to do some blood tests and further investigations to look further into the problem.
Okay, well, let's just look at this particular case. What do you think would be the top of your list as a cause of the tender hepatomegaly in this 21-year-old student?
So I would be considering hepatitis as a top differential, probably
Okay.
viral hepatitis or
Viral hepatitis.
alcoholic hepatitis.
Okay, what if I add in a little piece of history about Luke? He has returned 2 weeks ago after a holiday to the Central African Republic. What would you like to think about?
So I'd like to start thinking about hepatitis A, hepatitis B, hepatitis C, and hepatitis E.
Right.
Although hepatitis B would be a bit unlikely, taking into history his 2-week history of return.
Okay. Okay, well, have you come across any blood tests that would either confirm or rule out viral hepatitis?
So we'd like to do some serological tests for hepatitis.
Okay.
So for hepatitis A, I'd like to check his anti-hepatitis A antibodies, IgM antibodies.
Okay.
For hepatitis B, I'd like to check his hepatitis B surface antigen,
Okay.
hepatitis B core antibody,
Okay.
and hepatitis B E antigen.
Right. Which is the antigen that goes up first in hepatitis B?
So that would be hepatitis B surface antigen and hepatitis B core antibody.
Okay. Okay. Let's just come to hepatitis A. What type of antibodies are you expecting to rise initially?
So within the first 4-week period, I'd expect a rise in the IgM variety of the hepatitis A antibody, and
Okay.
afterwards I'd expect the IgG
Okay.
rise.
Okay. That's good. Okay. Thank you.